Hello, and you're very welcome to Adapt Radio. My name is Dr. Claire O'Connell, and today we're talking about how AI can help people living with cancer to talk to their healthcare teams.
From the Adapt Centre at Trinity College, this is Adapt Radio, presenting groundbreaking innovations, one conversation at a time.
Now, how many times have you gone to the doctor, had the chat, and then on the way home from the appointment realised there were things that you forgot to ask about? Well, today's guest is working on AI technology to help patients to discuss their quality of life issues by recording questions and topics with a dedicated AI ahead of the appointment of meeting with their healthcare team. Denis Roche is CEO of eAltra, a platform that offers patients the opportunity to reflect on and record questions ahead of appointments. Denis, you're very welcome to the programme.
Thank you.
First of all, congratulations, because eAltra recently won the Best Emerging AI category at the recent Spark crowdfunding Top 100 Most Ambitious Companies in Ireland. So congratulations on that.
That's great. Thank you very much. Yeah, no, it was great to get the award.
So tell us more. eAltra, Altra, of course, being the Irish language word for nurse.
Yeah.
So what is it? How do people use it?
It's an online platform, a web app essentially. So anywhere you can get online, like through your phone or through a tablet or computer or whatever, you can use eAltra. And it's a conversational AI dialogue system that was developed during a period of the Adapt Centre in Trinity using an Enterprise Ireland commercialisation fund. So we developed the technology over 2 years, really looking at how we can improve the kind of existing technology that's in the market. A lot of what you see is based on old systems, and they're not very nuanced in terms of how they can interact with a patient. So we tried to take that a little bit further with our tech development.
So if I were going to use eAltra, how would I do that? I'd have some app on my phone or my computer and I'd go into it in my own time. What kind of an interface would I see and be interacting with?
Yeah, it's like a chat. It's like messaging, it's like backwards and forwards. I was working in a place called the London Clinic in Harley Street in London, and I was working in the head and neck cancer service there with a very accomplished, knowledgeable clinical nurse specialist. With a diagnosis of cancer, the patient is given information about what's going to happen over their treatment period, what the kind of impact it is. It comes generally in leaflet form these days, and you get handed a big pile of leaflets. And then a lot of the time over the next 6 months of your treatment or so is spent kind of asking questions that are contained in that information. And, that's a big part of what nurses do. They educate patients. They're there for patients who have got queries about what's happening with their symptoms and how to manage them and side effects of treatment and all those kind of things. But what we saw was that we could use a bit of tech to kind of make that process better. We could make the information available all the time. We could really work on making it more engaging for patients that they might want to come back to it repeatedly, and it would be a trusted information source for the patient, so that they're not going, everyone says Dr. Google, but going online, Googling symptoms, Googling things, ending up in maybe scary places on the internet that are not great for anybody to see.
So the person who's using the platform then has a question or a concern about something. They can go in, they may get their question answered directly by the AI. Is that correct? Or do they all get referred on to the healthcare team for the next time that they're talking to them?
With the way things are at the moment, it's a very direct interaction with the team. In between your chemotherapy, if you're getting chemotherapy, the team need to assess how you reacted to the last cycle of chemo. Was there any adverse events? And the reporting of that is very important, as to whether you're going to get your chemo the next time you come in. And the way that it's set up in a lot of cancer services is that, that generally happens when the patient is in the hospital about to get treatment.
Turns up for their appointment, yeah.
And so if there's a problem, it creates a knock-on delays in the patient getting their treatment. So in these very specific cases, we've pushed it out so the patient can notify the team before coming to clinic, and anything that needs to be addressed can be picked up earlier so that the nurses can make arrangements for that to be handled in a better way.
Is it the case that sometimes patients experience quality of life issues that are quite individual to themselves, maybe as they go through the process of chemotherapy or radiotherapy or post-surgery. Can those be dealt with outside of appointments then? Do the nursing team and the doctors have the ability to sort of reassure the patient or say, you know what, we might need to change your appointment date based on that? Is that part of it as well?
What we've done with eAltra is we've established what would be known as a patient-reported outcome measures or needs assessment tools, and we've incorporated some of those into the conversation design of the platforms. And we've also observed and worked closely with nurses to see their interviewing style and how, what's kind of coming up when they're asking patients about their symptoms or what's going on for them. Some of those measures are around how the treatment is affecting the patient. Some of the other tools, like a thing called a patient concerns inventory, is specifically about if you're coming for a follow-up, what are the things that you want to talk to your consultant about?
Mm-hmm.
Because as you alluded to there, and in your intro, patients come to appointments. It's quite a limited period of time that's available, and that's across healthcare systems throughout the world.
Sure is.
So there's not a lot of time for the consultant to understand the problem and then do something about it. So a lot of the time can be spent kind of getting out of the patient what it is that exactly that they want to talk about or what's affecting them. And then, that can take a good chunk of the appointment. And then what's remaining then is, but what can we do about it? How can we make this better? So the patient concerns inventory kind of allows the patient to identify in advance of the appointment, oh yeah, this is actually what I want to talk about, and kind of make a bit of a record of that and then bring it to the appointment.
Sure, before they go into the stress of travelling to the hospital and going into the appointment and waiting, etc. It's a very different environment, isn't it?
Yeah, all that sort of stuff.
And so it's currently being tested in James's and Tala as well, is that right? Yeah. So how's that going? Are patients engaging with it? How are clinicians finding it?
Yeah, so we've had some really positive feedback from both groups. The trials were about establishing could patients use this, it's a usability type assessment. And because, cancer is sort of a disease of older people in that sense, and a big objection to using tech in these kind of instances that people wouldn't be able to use it. But we've had very, very positive feedback in terms of usability. Like almost everybody's been able to use the platform. That's part of the reason for using a conversational approach, is that you're trying to meet patients where they're used to being communicated. That's been really positive. And also what we wanted to establish was that there was a kind of an equivalence between what the system was getting and what nurses were getting in their interviews, so that it was safe to use. Like that, if we're getting the same, if not better, information through using the digital platform. Now, that's not to say that a digital platform is replacing nursing interaction, and that's not the intention of this. I think that's kind of a bit of a misstep that's going on in the industry at the moment, where there's a lot of hype around using large language models and kind of, trained medical models to kind of replace clinicians. And I just don't think that what's out there is anywhere near that yet. And I'm not sure that that's the approach. It's definitely not the approach that we're taking. What we're trying to do at eAltra is to kind of equip the patient as best as we can. Give them the information that they need in the way that they want it at the time that they need it. And so with the intention of making the process of accessing treatment with a human, with a clinician, we can optimize that, try to make it the best that it possibly can be. So they do get to ask the question that they want to ask. They remember it when they're in there, and it's relevant to what's going on for them.
Yeah, which is brilliant, because patients, healthcare systems are complex. Each sort of department probably has a slightly different way of doing things. And it can be difficult for patients who are going through a tough time anyway to even know, how do I get to talk to the person I need to talk to? So if you have this portal almost with this conversational AI, that must be hugely reassuring for them to know there's a place I can go and I can put this information and somebody will be able to see it.
Yeah.
I suppose the old-fashioned way of doing these things was just, write it down on a note and bring it into your healthcare team, which is very low tech.
Yeah.
In terms of the advantages that AI can bring here, is it possible to sort of personalise a patient's journey through the system as well? Does the AI keep track? Well, the last time this patient was on, these were the concerns they had. Is there sort of a longitudinal following of them through the system as well?
We're just at the start of that sort of stuff with the eAltra, because really what the work so far has been, getting the basics right about safety and information that's useful to the clinicians and to the patients. A lot of the practice of gathering patient-reported outcome measures is kind of like a snapshot of where a patient is at their treatment, and just because of the kind of analog nature of writing things down, or forms are posted out to patients, there might be a lag about them being filled in and sent back into the system. So taking a digital approach with a sort of always on function, we're trying to get more granular and take a longitudinal approach to and gather more snapshots of the patient's health, just by getting patients to think about their symptoms and engage with the information. That has an uptick in terms of their outcomes, so it's a positive thing. But the barriers to doing those in a widespread way are just the lack of tech and infrastructure and understanding about their benefit in the community. So at eAltra, that's what we're setting out to kind of address those challenges.
Okay, so part of it is raising awareness across the board of the need for patient-reported outcomes then. So these patient-reported outcomes are the things that the patient can sort of identify happening, and that can then feed back into the healthcare team to help them understand, what the patient wants out of the process as well.
Yeah, absolutely.
Sometimes the patient just wants to be able to run around with their grandkids.
Yes.
Whereas the healthcare team might be more focused on a particular blood marker or something like that.
Yes.
Is that so? Are you trying to sort of broaden out that side of things as well?
Yeah, well, it's important because, survivorship is a theme in cancer care and health-related quality of life. So, the amazing work that clinicians are doing, the treatment of cancer is getting better, and more people are surviving. But the theme of health-related quality of life is like what kind of quality of life you have when you're getting treated and after you've been treated. Getting patients to engage with symptom management during their treatment and afterwards does improve their outcomes, they will have a better quality of life, according to research. So it's a good thing to do. But as for the reasons that I've given before, there's just not the infrastructure there to do that in a kind of large scale way.
Yeah, no, you do need the capacity to be able to take on that information and integrate it.
Yeah.
In terms, speaking about healthcare information, do you find any challenges or need to sort of address things around privacy of healthcare data, access, shareability? Have you encountered that along the way?
Yeah, look, absolutely. I mean, healthcare is working in health data is a protected area under the GDPR. It's a special area. So we use a kind of data minimization principle. It's, in what we're using in terms of how we interact with that information. So we are integrated into the electronic health record, which is the single source for patient information, their demographics, their test results, and all the rest of it. And then the clinical team can launch eAltra or they can automate the launch of eAltra from the EHR. And then we just gather the information and write it back to the EHR and try to keep that to, knowing anything about that patient to a minimum.
Right. So keep it within those walls. Yeah.
It's sensitive stuff. So it needs to be taken very, very seriously. But there's a huge benefit for sharing of that data. And the GDPR is about protecting the sharing and facilitating the sharing of data. It's just, doing it in a correct fashion. And we can do that in a very good way. But it's through the kind of careful curation of the content that the patient accesses. We've studied workflows and made that easy for clinicians to do that curation. So that the information is good.
Brilliant. And tell us a little bit more about the research at ADAPT that underpins all this.
There's huge level of expertise in ADAPT. So we worked with a team there who had previous experience in dialogue systems that were set up for language learning, for teaching people languages. They built a new system for us, and a lot of the process over the time was going out to the clinical teams saying, is this what you want? Oh no, that's not what you want. Okay, let's go back again, and kind of seeing what kind of features and functions they would need to make the platform successful. So, the people at Adapt really are on top of that.
So we're getting back to more that kind of these AI agents or AI assistants that are almost like your helpers through the system. Is that what you're seeing in healthcare now?
Yeah, I mean, that's the goal in terms of getting it to a place where agents could successfully move across an entire healthcare system. Takes quite a high degree of focus in terms of data management and the underlying systems.
What about integrating things that are maybe outside of the hospital system? Do you see the scope for things like wearable technologies or even environmental data around patients as well, ultimately feeding into that big picture? Is that a direction of travel in healthcare, do you think?
As complete a picture of the patient as possible is a goal, I think, for healthcare. But the most important thing about patient-reported outcomes is that they should be actionable. So if you're getting a patient to do this thing, you need to be able to do something about it for them.
Mm-hmm.
With all the best will in the world, if somebody's telling you about their heart reading on their wearable, is it going to help you right there and then, or can the clinician do something about it? I have no doubt in the future that that's what will be happening, and there will be a shift in that relationship, because the data will be good, really, really good, really available and streamlined. It's all getting better in that sense, but we're not there yet. And we should keep striving to be there for sure, because there's a twofold kind of benefit where it's like clinicians know more about their patients, but also a patient knows more about themselves and is kind of engaging with what's going on for them. What can I bring to the table around this treatment process?
Yeah, and the platform creates a space where those benefits can happen safely. And what about the clinicians themselves? You are working with clinicians actively at the moment with eAltra. What kind of feedback are you getting from them? Is it impacting their workload, their insights?
Yeah, so the team in St. James's have identified that they think it's going to bring the time that they spend on doing some of the tasks that are associated with doing an assessment around toxicity down by about 50%. So that's a good number.
That's big, yeah.
Also, it feeds into kind of streamlining or improving the kind of patient scheduling process. If you know that the patients you're getting are all going to be okay to get treatment on the day, that makes a huge difference, obviously, to what a service can do. We're only getting into the beginning of that. A lot of our focus so far has been on establishing the safety of the system and, whether patients can use it. And now we're getting into kind of using it properly in care. Well, we had some trials going where we were doing that with live patients who were coming for treatments, but it wasn't directly in their care pathway. Wasn't so they were getting business care as usual plus us. So now it's moving in St. James's more into that idea where they will be using it actively in their care. So that's an exciting phase for us. So we have the toxicity screening or assessment process in St. James's and Tala. We're working with the patient concerns inventory type tool with in the head and neck cancer follow-up clinic, and we're also talking to the Royal Free in London about stuff around prostate management and in the community, and also working with the team on speech and language therapy in the Clatterbridge in the NHS about when patients come off treatment back in the community, they know that there's going to be late effects of the treatment that they've received, and they just want to be there for when those occur, and if and when they occur, but most likely occur, and the patient has a good way to get back in touch with them or to be supported through information exchange. With the surgeon in St. James's, he just wants to get the best out of the consultation for his patients so that he knows that he's addressing the issues that they want to talk about. Mm-hmm.
Brilliant. Well, it's exciting times for eAltra. And thank you so much, Denis Roche, for joining us today. And if you would like to find out more about eAltra and ADAPT's research in this area, you can find lots of information in the show notes and at www.adaptcentre.ie. That's it for our podcast this time around. Until next time, from myself, Claire O'Connell, Slán, and thanks for listening.
The Adapt Radio podcast is brought to you by the Adapt Centre at Trinity College Dublin. Find out more about their extensive research work at adaptcentre.ie. Join us next time to hear about more groundbreaking innovations. To get new episodes automatically, just click the follow button on your player right now. The Adapt Radio podcast is produced by dustpod.io with episodes monthly on Apple, Spotify, and wherever you get your podcasts.